Hi, I'm Dr. Rupert from Viva Skin Clinics. Welcome back to the YouTube channel, and today we've got a little bit of an interesting one to talk about. So with such little and unvalidated information out there, I wanted to give you guys the proper rundown on what's called the P-shot. I'm going to give you guys a rundown of what the procedure entails, and we're going to go through a questions and answer session with one of my favourite clients. So you may have heard of what's called PRP, or platelet-rich plasma. So in fact, you can use PRP to inject anywhere in the body for rejuvenation. And it's been found that the P-shot, or injections of PRP into the penis, actually work really well for erectile dysfunction. So let's move on to the Q&A. Sergio, thank you so much for joining us today.
Welcome.
So tell me any questions that you have in regards to the procedure.
How long does it take to get effect?
So the results start after the first really 24 hours or so.
What exactly is the P-shot?
So the P-shot is PRP injections into the penis. So you guys may well have heard of this from things like the vampire facial. So what we do is we take a blood sample, we put that into a little bottle that goes into a centrifuge, and a centrifuge is something that spins round very fast. This separates the components of the blood, so you're left with the platelet-rich plasma that can be used for rejuvenation. So you can actually inject that anywhere into the body, and we've found from studies that it drastically improves things like erectile dysfunction and also Peyronie's disease when used to inject into the penis.
How long the treatments last?
You'll find that the treatment lasts around 6 months. So classically, I normally tend to do maintenance sessions every 6 months.
How many sessions do normally a patient need?
So it's a really good question. I tend to find that everyone is individual. So sometimes only one session is needed for the beneficial results, and then the maintenance every 6 months. However, sometimes I may do up to 3, spaced by about 6 to 8 weeks apart.
Does it hurt?
So, very good question. You can imagine that it might be a bit stingy with injections down in that area for sure. What I do is I infiltrate or I inject local anaesthetic, which completely numbs the area before I carry out the procedure. So that makes it as pain-free as possible.
Do I need any kind of exercise or something after treatment?
Yeah, another good question. So it's really important to maintain good lifestyle factors when you have these procedures done, because that also helps improve your results and in the long run too. So exercise, making sure that you're having a good diet, and eating lots of healthy food as well, all of which are really important. There are some useful supplements that can be taken alongside the procedure to improve results as well, one of which is L-arginine and also Q10, so coenzyme Q10. There is studies to suggest that these do help in terms of improving your outcome whilst having the PRP injections carried out.
How long does the procedure take?
The procedure classically takes about 20 minutes. 10 minutes of that is actually taking the blood sample and spinning it off. So that in itself takes around 10 minutes, and the injections are very quick. I use a very, very small micro needle, so a nano needle, to inject the product, which means that it's less painful too.
And how many injections?
Other than injecting the local anaesthetic, there are 6 injection points for the procedure. 3 at the base of the penis, 2 on the shaft, and 1 in the end.
Is there any benefit on size and girth?
It may have a benefit on size and girth. This isn't the same on everyone. Most people report improvement in girth. Sometimes size, but that's less common.
Is there any side effects for that?
Sure, good question. So the product is injected into the penis, so there may well be a little bit of swelling, maybe a bruise. That can happen as well. So it takes a little bit of time for everything to settle in. So other than that, as we're using your blood to inject into the penis, there is relatively few side effects otherwise.